over about the last 8 years or so, we've been funded to promote shared decision making at Carolina's healthcare system. And the way that we try and do that is through engaging the patients. And we think of shared decision making as a meeting of two experts. So the patients are the 100% experts on what is important to them. So that means their lifestyles, preferences, what they like and don't like, what they think about the side effects of medications, what's important to them. So it's not necessarily about disease knowledge. And then we say that it's a meeting of two experts, and the provider is simply the expert on the disease and some of the pros and cons of different treatment choices. So shared decision making is bringing those two experts together. The patients don't necessarily know what they want, and so we have a sort of a fairly well-established method of engaging the patient in the idea of doing shared decision making, and we don't really linger on it. There's a whole 5-step process, and the first step is introducing the concept of shared decision making and building that rapport, but we don't stay there too long. We try and engage the patient pretty quickly using a tool or a dial or something that gets them going on the process rather than having them contemplate what we might be talking about. It's better to quickly say what it is and then move into the program. Providers pretty typically tell us that they don't have time for this, that they don't have resources for it, and that they think it's a good idea, but they don't think it's going to work for their patient population. So in dealing with that challenge, pretty much I tell them that I think this is what they're thinking about, and that's about that, I kind of lay it out there that I think you don't have time for this, or that it won't work with your patient. So they tend to look a little bit like, oh, how did she know what I was thinking? So that gets them at least listening to me, because then I'm ready to say, we can help you with this, and I think you'll find that it is going to work with your patients, and that we can find ways to help you make time, because once you see your patients are not ending up in the ED so much or in the hospital, and they're actually really part of continuity care, then I think you'll find that you want to make time to do this. So the best surprise has been some of our providers who I work in Department of Family Medicine, and we think of ourselves as the relationship doctors. That's our expertise. I think some of the surprises have been some of the doctors that I held in really, really high esteem actually turning to me and saying, this has been a humbling process. I thought I knew how to interact with my patients, and shared decision making has made me realize that I wasn't reaching them as best as I could, and the program has helped me even reach them better. So that's been a really nice surprise. I think there's some really exciting things that I think we're on the cusp of seeing change around. One is the technology, bringing in apps, bringing in different ways for the patient to sit in the waiting room and actually start some of the process, start looking at some of the ways that they can share in the decision. And the other is the payer model, and having these bundled payments, and having ways of really getting a team together that can tackle shared decision making, and not just expecting just the provider to be part of that, but to actually have health coaches and peers who are trained in really connecting with the patient and engaging this process.